Hi, my name is Dr. Megan Fox. I'm a clinical psychologist and implementation science specialist with Centerstone. I have experience in providing telehealth services with clients as a result of working with deaf and hard of hearing clients who have limited access to care and as a result of the recent COVID-19 pandemic. When setting up your workspace to deliver telehealth services, there's definitely a few things to consider. First, pay attention to the room design and organization. I suggest not facing a window, but rather a wall, and also using a still chair, not one with wheels. The lighting is a really important aspect to pay attention to. You want a well-lit room, but not an overlit space during the daylight hours and the evening hours. You'll have to test it out with your lamps and your overhead lighting. Your camera placement and distance is also really important. From waist up is typically best. Soundproofing may be necessary. You want a reasonably quiet space, and if you're used to using white noise machines and having them outside of your office door or in the hallway, you may want to turn these off or check it to see if they're disruptive. Something I've learned through the practice of telehealth services is to pay attention to the colors of your clothing. Dark and neutral colors with minimal print is best. You might also want to consider having some props or other tools nearby, such as a pen and paper in case you need to take notes, tissues, having a glass of water. You may want to ask the client to do the same and also ask them to have an object nearby that helps with stress relief. And last but not least, test all of this out with a colleague that you're consulting with. There are certainly a few things that clinicians can do before their first telehealth session. They can confirm the session and the technology that is being used with the client. They can also check that the informed consent documentation has been completed. Check with the client regarding insurance coverage and discuss the responsibility for fees. Clinicians should also close all background programs and turn off notifications for all of their devices. Confirm that the internet connection speed is at least 10 megabits per second. And check that the webcam, microphone, and speakers are working, and also that the audio isn't automatically muted. Clinicians can certainly declutter and tidy up their space, set their cell phones to silent, but maybe keep it nearby if that's part of your technology plan B for contact with your client. And certainly last but not least, maybe you hang a do not disturb sign on your door. From the patient's perspective, a telehealth session should look very similar to a typical in-person session because the clinician is in a typical office space, not their couch at home. However, from the clinician's perspective, the environment that the client is in may be the more unique aspect of the session. For the first session, there are certainly a few things that we can discuss with clients. One would be the logistics and the protocol of the telehealth appointment, including programs and software that were used, as well as the possible awkwardness that could come with pausing in silence. Confidentiality and privacy is a really important thing to discuss during the first session. You want to confirm who is in the room, who is in the house, and that nobody will record the session without permission. I also suggest asking clients to turn off notification alerts on their devices. You should certainly also discuss insurance coverage and informed consent if you haven't obtained that yet. Check out Centerstone's Telehealth Clinical Education Series video, Obtaining Informed Consent, for more information. Also during the first session, if the session is with a minor, discuss a plan for communication and check in with their legal guardians or parents. We should also discuss any possible disruptions in advance for both parties. If a dog might bark, or if a colleague might knock, it's important to let each other know that in advance if we can. During the first session, we should also discuss the consistency of therapy attendance as well as homework completion if this is something you use in your treatment. Keep your eyes out for Centerstone's Telehealth Clinical Education Series video on coaching clients on using telehealth, including how to help clients manage questions and anxiety about telehealth.